So to start off, thanks everyone for joining us this evening. We've got a really interesting topic for tonight, very timely. And as we see across Canada, especially in recent years, with the various natural disasters we've seen, the various changes we've seen in climate and also in the pharmacy landscape, I think this is very timely. So definitely want to thank our guests for joining us this evening and for everyone else listening in. I have one of our pharmacy students, Fatima, on the call with me tonight. She will be moderating with me from the whole health side, but I'm very pleased to be joined here by Dr. Shaliza Sajwani and Jason Wenzel. Many of you already know Jason as a banner partner, and you may have met him last month at our conference where he presented about oncology. Jason owns Extend Pharmacy in Ottawa, which is a specialty oncology pharmacy, and he's here tonight as co-founder of Climaceutics. I would also like to introduce Shaliza Sajwani. And Shaliza is a pharmacist who works within areas of climate change, global health, and oncology as they relate to the pharmacy profession. Shaliza received her Master's in Pharm from Aston University in the UK, her PharmD from the University of Toronto, and her Climate Change and Health certification from Yale University. She is the national co-chair on the Canadian Association of Pharmacy for the Environment and is also the co-chair of the Ottawa Hospital Pharmacy Environmental Committee. Shaliza also co-chaired the International Pharmaceutical Federation Policy Committee, which created and passed the first ever international pharmacy climate change policy in 2023. Well done, Shaliza. She is currently the president of Climaceutics Health Solutions, which focuses on building a tool and certification process for pharmacies to reduce their emissions and to improve their climate resilience. So we're very pleased to have these wonderful guests tonight. Before I pass them off, I'd just like to remind everyone that you may put your questions in the chat. We'll be saving them to the end of the presentation. Please also keep your mic on mute, but definitely if you have any questions, either raise your hand or put your questions within that chat, and Fatima and I will be moderating and making sure that we get to them by the end of the presentation. So with that, why don't I pass it over to Shaliza and Jason?
Perfect. Thank you, Molly. Thank you very much for having us. It's wonderful to see so many familiar names and a few familiar faces here on the call this evening. I'm really happy that Whole Health has had this platform for really Shaliza to kind of share a little bit of her story and why this is so important to us as community pharmacists. I've had a great opportunity to interact with Shaliza. Our careers have kind of been interwoven at various points throughout the past 10 or so years, including working together, both at the hospital and both in oncology. So I've always been very interested and intrigued by really what she's doing in the climate space. And I think, she's built this incredible niche expertise that, I've really just begun to appreciate over the past year or so. And, I just wanted to jump on and say a few words really quickly, and then I'm going to kind of get out of the way and let Shaliza really kind of share her expertise here. But really what kind of caught me as a pharmacy owner, kind of learning a lot about this over the last little bit, is I want all of you to, as we go through this, to really think about like, how do you differentiate your pharmacy practice? And I know many of us kind of, are looking for new innovations, are looking for, ways to give ourselves sort of a, a care edge or a practical edge or a business edge. And we think about things like, specializing in a clinical area, whether that's elder care or diabetes, or in my case, oncology, or we're looking for, different innovations in how we partner with physicians and allied health and different things like that. And as we go through tonight and talk, I really want you to think like this is an untapped avenue to differentiate your pharmacy practice in this conscious awareness of like climate health and climate care. And the more that we kind of went down this road with Climaceutics and developing this tool and this product to help community pharmacies, we really began to see that there's kind of this Venn diagram of the climate impact that the community pharmacy has, and through mitigation and adaptation strategies can actually help reduce emissions and the carbon footprint from a pharmacy point of view. But there's also this huge piece that I wasn't aware of until Shaliza really introduced this to me around how climate actually impacts clinical care. And Shaliza is going to share a few cases this evening that hopefully will help to kind of share that messaging. And then last but not least, of course, is this avenue really to differentiate your pharmacy practice based on building of climate or eco-friendly principles within your pharmacy. Perfect. And then the last little bit before I switch over to Shaliza here is we're not kind of just making this up. This comes from Canada Agriculture and Agri-Food, a big environmental sustainability survey around shopping habits for customers. And this is not exclusive to pharmacy by any means, but as you can see that really a lot of shoppers, retail customers, this is very important to them. So kind of these concepts of the concern around environmental and climate change. So we haven't seen this come into the pharmacy space yet in a significant manner, in that people have choice of pharmacy based on kind of sustainable or climate friendly habits. So if this mirrors kind of other trends that are happening in a retail space, one could extrapolate that differentiating in this area in pharmacy would only be encouraging from a business point of view as well. So with that, I'm going to hand this over to the main event, and I think you're all in for an excellent and eye-opening talk this evening. So thank you.
Amazing. Thank you so much, Jason, and thank you so much, Molly, and to the whole health team for having me here today. So yeah, I think Jason's segue was great. I'm going to just quickly talk about a personal story here with regard to this Venn diagram. So 5 years ago, I was actually I had just gone into remission from ovarian cancer. And when I was diagnosed with ovarian cancer, I had already been a cancer specialized pharmacist prior to my diagnosis. I'd been already practicing for a few years, and then suddenly there was this diagnosis that came. And I remember going in for treatment and coming and sitting down and getting my first chemotherapy for the first time, and then getting my pre-meds and PRNs dispensed from the community pharmacy. And that week, Ottawa was hit by 7 tornadoes, and very, very scary. I remember Maribel in Ottawa was hit very, very badly. That was very close to where I was living. And I remember thinking that, oh man, are these tornadoes going to actually affect the hospitals where I get treatment? Are they going to affect the community pharmacies where, I get my medications? What's going to happen? And how is this going to impact potentially my outcomes? Since then, extreme weather events, of course, as we know, over the last 5 years or so have worsened in severity and intensity. And whether we're talking about wildfires, whether we're talking about flooding, extreme heat events, which is kind of considered a form of extreme weather as well. And generally, these are all kind of things that we need to keep in mind with regards to climate change more broadly. We will specifically talk about a couple of cases here. And I'm just going to read them out loud, but for now, you may have some challenges in trying to understand how to solve this case, but by the end of this presentation, you guys will all be experts in understanding how to solve these couple of cases. So the first case is an 80-year-old female patient, a 80-year-old patient who identifies as female, and she is being seen in your community pharmacy and is complaining of some worsened shortness of breath. And she has a new diagnosis of metastatic lung cancer. She also has a previous NSTEMI from a couple of years ago. She has hypertension and she has moderate osteopenia as well. And remember, she has a new diagnosis of metastatic lung cancer, in this case, non-small cell lung cancer. Her social history is that she has low income housing with no air conditioning. And when we opened up Clinical Viewer and her labs were normal, the medications that she has on her file were rosuvastatin, vitamin D, vitamin C, ginseng. So of course, she just has a note on her file saying that she's taking vitamin D, vitamin C, and ginseng. She's also taking alendronate and perindopril, bisoprolol, salbutamol, and salbutamol PRN is basically a new prescription that has been prescribed by the family doctor upon the shortness of breath as well. And one thing that is important to note here is that, her diagnosis is actually, her metastatic non-small cell lung cancer has spread quite a bit prior to it being diagnosed. And her prognosis is now, she has a less than 3-month prognosis. And both her and her family have kind of discussed together, and they've decided, that she prefers not to proceed with chemotherapy at this time. So we're going to talk about some DTPs that are related to climate mitigation specifically. And then we're also going to talk about climate adaptation. So this is where a 65-year-old patient arrives at your community pharmacy to pick up some discharge medications from the hospital, and she's on rosuvastatin, perindopril, bisoprolol, escitalopram. She was previously on valproic acid, which is discontinued, and she's now on lithium. The levels are within range at the hospital. She has a previous medical history of cardiovascular disease and bipolar disorder, and she also has low-income housing as well. And the environmental indicator, something new, environmental indicator, is that the temperature outside is 39 degrees. And Environment Canada has indicated a heat wave warning. So there's some things that we should keep in mind with regards to her specifically for her counseling. But we're not going to talk about these two cases in detail yet. We're going to talk about them at the very end of this presentation, because you're going to learn a few things that are going to be helpful for you to be able to apply to these particular cases. So again, I just want to reiterate, wherever you live in Canada, climate is no longer a future thing. It is not a low-income country thing only, although low-income countries have been impacted quite a bit, whether we talk about capacity or whether we talk about geographically where they are at. Whether we're talking about wildfires specifically in BC or in the Western provinces in general, whether we're talking about flooding in several provinces, the heat dome that hit BC specifically a few years ago. We remember what happened specifically there, where over 600 people passed away. So every province, I don't have a picture of the hurricane that hit the Atlantic provinces on this slide specifically, but what I want to really emphasize here is that this is not necessarily something that is just specific to one province. Whether we're talking about wildfires, whether we're talking about floods, whether we're talking about extreme heat events, this is really a coast-to-coast thing with some variations from province to province. The situation is that the IPCC has mentioned that we can act on climate change, but time is running out. They've mentioned that the political interest is clearly growing and that there are initiatives that are starting to happen within this space as well. But in order to be successful, we can't wait for decades to act. We have to act specifically now. We weren't taught about climate change during pharmacy school. The entirety of the pharmacy curriculum was taught to us under the assumption of a stable ecological system. So just a quick overview. If you think about the greenhouse gas effect, where we basically emit greenhouse gases, and you can see some cars here. It's not just cars that emit greenhouse gases, as you will know shortly, but let's take that with a grain of salt. We emit greenhouse gases. Those greenhouse gases basically act as a coat. like you're wearing a winter coat for the Earth. They basically trap the sun's heat. So what is supposed to happen is that the sun basically, of course, radiates this heat, and it's supposed to a lot of that is supposed to basically be reflected or refracted back to the atmosphere. But what happens is that these greenhouse gases trap some of that heat, and therefore temperature rises. So that temperature rising causes a whole host of downstream effects, including significant impacts on health as well. So the one thing I talk about when I'm thinking about, the IPCC warnings and generally what we've seen in the news is that this is a time of urgency, and it is also a time of opportunity. So these are some of the questions that I might get if I'm presenting specifically about climate change, and specifically to a specialized audience. Let's think about pharmacy. So the first question is this really in our lane? We are pharmacy professionals. We have enough on our plate already with regards to everything that happens on a day-to-day basis. And I'm going to challenge you a little bit here. Actually, the healthcare system has a bigger emissions burden than even the airline industry. So that means that if you take all of the flights that happened every day and you times them by 365, the healthcare system actually causes more emissions than the entirety of the airline industry combined. And medications actually count for 25% of all of these healthcare specific emissions. So automatically, we are on the front line of this from purely an emission standpoint. On the other hand, pharmacy services are also very vulnerable to climate hazards. So you can think about the story that I provided about my own experience going through treatment, but think about even if you have an extreme weather event that hits, let's say, somewhere very far away from you specifically, that can cause kind of an overnight supply chain problem. So whether we're talking about inventory, whether we're talking about specific services that are usually provided that could be disrupted, like vaccinations, when we're thinking about disruptions to refrigeration, like just pure dispensing, when we're thinking about disruptions of extreme weather events to computer systems. There's a lot of potential impact here that we can think about implementing business continuity as well as disaster planning as part of climate adaptation. So thinking about how do you basically adapt to the existing environment and adapt to the climate crisis. The second question I usually get is that, well, isn't this like really expensive? And actually there are cost neutral and profitable ways to be able to reduce your emissions and reduce your pollution. And there are also ways to be able to save costs with regards to improving a resilience against climate hazards. Let's say if you have less of a disruption to pharmacy services, you're automatically saving funding that way. And then doomsday versus more time. This is really interesting, depending on who I'm presenting to. Most people are saying that, yes, they're kind of sold that this is a time of urgency and opportunity as well. But at the same time, sometimes you'll have individuals who will say that, oh, don't we have more time to do this? Isn't this kind of like a future generation problem? And yes, future generations are going to be hit quite hard by this, and this will be certainly front and center, but this is actually a now problem rather than just a kind of future specific problem. And on the other hand, you will have others who say, isn't it too late? So the complete opposite end of the spectrum. And no, actually, there are significant ways that we can reduce our emissions right now. It's not too late to be able to work on something like this. So when we think about the impact of climate to human health, there's all these different impacts here, and I'm not going to spend too much on this slide, but this is like, if you're looking for a few takeaways for this presentation, and you have so much on your plate right now, I would recommend kind of taking a screenshot of this or taking a picture of this particular picture. And this basically describes your impact of climate to health more generally. So whether you're talking about heat-related illness, so heat can cause worsened cardiovascular morbidity and mortality. You can also have extreme weather events that can cause climate migration, so migration from one part of the country to the other, or migration from country to country. And it can actually increase your risk of civil conflict as well. On the other hand, when you have changes in precipitation and you have changes in temperature, you can actually have changes in incidence and prevalence of infectious diseases, including certain infectious diseases that we're not as familiar with. So really, really good idea to keep keep an eye on these changes in infectious disease prevalence and incidence. There's a whole really interesting diagram of that I had seen in some of the work that I was doing about how kind of malaria, the incidence of malaria was kind of creeping up a mountain in East Africa and over a period of a few years. And it was really like academically, shocking and also academically interesting as to, why was this happening? And actually it was because of the changes in precipitation and temperature that allowed for, the mosquito to be able to survive at to basically proliferate or survive at in areas that it basically didn't before. So you can have some changes specifically here as well. And then of course, you also have impacts of air pollution specifically. So this one is not specifically climate related in the sense that it's not related to your greenhouse gas emissions causing global warming specifically, but it's the air pollution directly that is causing impacts on health. And this air pollution, so a really good example of this would be your air pollution that comes from wildfire smoke worsens your asthma, for example, and your patients with COPD. You have to really keep a really close eye on those patients when you have wildfire smoke. So this is a really good overview of all the different potential impacts. We didn't even talk here about the impacts to medication access. We talked about this a little bit earlier when we were thinking about supply chain specifically and when we were thinking about inventory management. But of course, medication access is a really significant challenge here. And then even you can add vaccination, pharmacies, any kind of pharmacy service access can be disrupted specifically by climate change. And there's certain things you can implement to help reduce that impact as well. So a few things to think about. So one is there's climate change, and then there's the planetary health more broadly. And planetary health is what normally you think about before you came to this presentation. When you thought about climate change, maybe the first thing you thought of was the amount of plastic vials that you're seeing staring back at you in your garbage bin. And actually, plastic pollution and pharmaceutical pollution are actually considered a broader issue of planetary health. So this is where plastic immediately has impact on health, because we're basically ingesting the plastic, and that causes reproductive issues and issues with cancers. And similarly, if you have medications going directly into the environment, you basically are, let's say, ingesting small, really low levels of antibiotics, for example, which can cause issues with antimicrobial stewardship. But this is considered a different issue than climate specifically. Climate is more related to greenhouse gas emissions. My own work that I work on, including the work with Jason, actually addresses both pharmaceutical pollution, plastic pollution, as well as climate change more broadly as well. But with climate change, again, I want to emphasize that the healthcare system actually has a bigger emissions burden than even the airline industry, and medications actually account for a quarter of all of those healthcare system emissions. When we're talking about mitigation, mitigation is just a fancy word for reduction. So what you're trying to do is reduce the amount of greenhouse gas emissions. And you can do that by various ways within pharmacy specifically. So one really interesting thing here is the usage of one inhaler, just the usage, not the manufacturing, not the transport, not the destruction, just the usage of one MDI inhaler is the equivalent of driving a car up to 170 kilometers in a gas car. So we can talk about, what can we do specifically for this? Inhaler technique that therefore becomes really, really important. Thinking about switches to dry powder inhalers where appropriate, where clinically appropriate, become really important as well. In general, oral liquids have a higher emissions burden than specifically pills. Deprescribing is also a really big thing. That clinically appropriate deprescribing is something that you can do that can reduce emissions. So again, this is something that we do anyways, but now we have another reason to actually think about this. Another thing to think about is reducing unneeded medication waste. So let's say you're ordering in a medication, and you don't actually end up using it, and then you send it for your returns back to the manufacturer, but this medication is actually not used, and the manufacturer is not necessarily going to reuse this medication. So I'm trying to think about how do you reduce your unneeded medication waste is also another way to be able to tackle this as well. A third area is carbon footprinting. So trying to think about the energy requirements of your facility, thinking about, your energy efficient lighting. There's some really interesting cost savings that can happen here too, along with trying to reduce unneeded medication waste and some of the other areas as well. And then in general, just trying to think about how do we reduce the amount of plastic within the pharmacy in general, and how do we reduce the amount of pollution. So these are all related to climate mitigation. And then some of these are also have a broader impact specifically to planetary health as well. Like we talked about the impact of planetary health specifically. So we talked about this. So within our tool that we're talking about for that I'll get into later, you can see the MDIs and deprescribing here. There are ways to be able to actually evaluate individual products, let's say from an OTC perspective, to look at, what specifically are what companies are have kind of like the B Corp logo on it. B Corp basically signifies that this kind of company is going in the right direction, specifically with regards to environmental sustainability and some other factors as well. Recycling is an area, carbon footprinting, thinking about inventory management, and really trying to kind of tighten that inventory management a little bit, waste reduction, social prescribing. So these are all areas that are specific to mitigation. And there are ways to actually implement SOPs to be able to help reduce your unneeded waste, for example. So, discouraging auto refills, for example, is another area where you can reduce your emissions as well. So with regards to our mitigation case then, we know that this patient was, had an NSTEMI a couple of years ago. We know that she has a couple of other comorbidities, and we know that she has a new diagnosis of metastatic lung cancer, and she's on all of these different medications. Some of these medications are actually potentially not indicated in a patient who, or maybe not as ideal in a patient who has a 3-month prognosis. We can't, just discontinue them, of course. A conversation has to happen with the patient as to what they feel about their medication specifically, and a conversation could potentially happen specifically with the family doctor, just mentioning that, are there opportunities specifically for deprescribing here. Salbutamol PRN is also prescribed for this patient, and she doesn't actually have a history of asthma or COPD here either. So that is also something to think about specifically for mitigation. If salbutamol PRN as an MDI was absolutely needed, specifically as an MDI, there are different types of MDIs that have different volumes of propellants. There's one particular type of salbutamol MDI that actually doesn't have as much of a higher volume propellant, which is a little bit better than some of the others, but there are also some opportunities for dry powder inhalers too. Climate adaptation is when we're trying to adapt to climate hazards. So what we're trying to do is, we acknowledge now that the climate crisis is here. It's not It's not going to be something that is necessarily just going to happen in the future. It's actually here. So therefore, what we're trying to do in climate adaptation is actually just protect our pharmacy. We're trying to protect our pharmacy and protect our patients from climate hazards. So whether that be, helping advise patients on what to think about with regards to wildfire threats, and thinking about public health specifically there, and thinking about what we need to keep in stock if specifically, there's wildfire season. What medications should we specifically be thinking about keeping in stock? Another area is understanding the impact of climate to health, which we've already discussed a little bit, about how it affects cardiovascular disease, how it affects, your infectious diseases. And that way you're actually able to consider that when you're doing your patient assessment as well. Another area here is medication management. So this is where you're thinking about, I have a patient on a diuretic and it's extremely hot outside. What do I need to think about with regards to this patient? I have a patient who's on a medication that is going to reduce this patient's ability to sweat. How are they going to be able to manage within a heat wave? So really thinking about all of your pharmacology and thinking about, are there specific impacts to medication management? Especially, let's think of patients who are on medications with a narrow therapeutic window. What is a difference of hydration going to potentially cause for these patients? Supply chain vulnerability is also a really big thing for climate adaptation. So thinking about, buffers specifically for supply chain, and thinking about your if your order didn't come in for a couple of days, would you be okay with regards to servicing your patients? And then finally, thinking about disaster planning. So thinking about, I'll get to that later, thinking about specifically, let's say if a disaster were to occur, from an inventory management perspective, do you have enough buffers in place? Let's say if you were to be thinking about a pharmacy sudden closure, how would you be conveying that to your patients? Let's say your services were to change, how would you be conveying that to the public and to your patients? Are there vulnerable patients who you would want to check up on? So all of these processes can actually be built in place so that you're not kind of flying by the seat of your pants during a potential disaster. So these are all the different types of things to think about with regards to adaptation. CPHA has put out some interesting good work with regards to natural disasters and pharmacy practice, the impact of climate change on health, the impact of medications, thinking about medication management within heat waves specifically. And then insurance is also a really important area as well. Does your pharmacy insurance cover extreme weather events? And do you need an insurance review specifically to look at whether it actually covers your extreme weather events? So this is some information with regards to disaster planning. So communication processes with vulnerable patients, with the public, with clinics, with nursing homes, thinking about service-related decision-making for business continuity, doing an assessment of what are the most critical hazards in your area, looking at training for staff, what specifically do they need to think about? Do you have your normal Kroll backup, a data backup system, or are there other options here? What would you do specifically for power and network outages, and are there some other options out there? And then thinking about insurance reviews as well. Now, if you're getting a little bit overwhelmed, don't worry. We are going to talk about some interesting things that might be able to that can support you through this and save you some time. For now, I would just focus on this case. So again, we talked about this patient who is on all of these different medications, including previously valproic acid, and now this patient is on lithium, and she's also on low-income housing. And guess what? Her low-income housing doesn't have air conditioning. And it's really hot outside, and Environment Canada has indicated a heat wave warning. So something to think about here is specifically the lithium. You know, do we want to make sure that this patient is monitored a little bit more closely because she's at high risk of lithium toxicity with the heat wave? And what would we recommend for this patient to be able to kind of keep in areas that are a little bit cooler? She doesn't have air conditioning at home, so maybe fans would be kind of useful for her. And then sometimes also the Canadian government also in heat waves, in extreme heat events, they will basically talk about cooling centers that will exist throughout the city. So they might be specifically useful for her. Wildfire smoke, if there was wildfire smoke a month later, some things to think about there is, ironically, inhalers for patients who have asthma and COPD. She doesn't have asthma or COPD, but giving her some recommendations, maybe that she should stay indoors, for example, if she were to have, if there's wildfire smoke that is outside, and just basically giving her some advice with regards to watching out for signs and symptoms of health effects that can be caused by wildfire smoke specifically. I won't go into that in much detail because of time. The FIP policy that was just passed in 2023 has some really cool recommendations here, specifically on climate mitigation. Again, reducing emissions, reducing pollution, and then climate adaptation as well. So if you search FIP climate pharmacy policy, you'll get this. That was passed in September of 2023. Your question is probably now, I have too much on my plate. I can't spend time on this because I have so many things to focus on, but I'm still worried about it because I'm worried that my pharmacy is really, at risk for disasters, or I'm really worried about, the emissions that my pharmacy might be causing, because working for climate changes is it's aligned with my value systems. I'm worried about my kids, and I'm thinking about, oh man, my pharmacy is now contributing to this, but how is this actually financed? And there are actually ways to be able to do this to save your time, and also to think about this on a cost neutral and profitable basis, which we'll get into. From a next step perspective, the Canadian Association of Pharmacy for the Environment puts out a lot of really good education, and there are opportunities to volunteer for the organization as well. And then, of course, Jason and I have now co-founded Climaceutics Health Solutions, which the whole point of Climaceutics is to kind of be there for you guys and for other community pharmacies who want to be able to take some initiatives specifically within climate mitigation or adaptation. And a quick overview of just what Climaceutics provides here. We provide basic tools, a screening tool with basic recommendations. We provide certifications to be able to help you, your pharmacy, kind of look at business differentiation, differentiating yourself as a different business, which are also available as well. And then we also provide a consultation time with myself as well. We have two programs, one which focuses on climate mitigation and one which focuses on climate adaptation. So again, more disaster planning focused. And for the adaptation one, we actually collaborate with a separate group called Disaster Pharmacy Solutions as well. And we also have a separate partnership with Sustainably Eco, which provides some carbon footprinting as well. So the mitigation program is here. The most basic tool basically gives you a screening tool and a report, specifically a recommendation report. The next kind of layer provides you with a certification and a bunch of templates that might save you some more time with regards to SOPs as well. And then the third layer also gives you everything the second layer does with added consultation as well. So it really depends on what you would prefer at different points. And if you go with one option, you can also escalate to a second option if you'd like later too. The adaptation option, remember, mitigation focuses on emissions specifically and pollution. And the adaptation arm focuses specifically on trying to protect your pharmacy from extreme weather events and disasters. And for this one, we have the certification, some templates, a tool and recommendation reports, as well as consultation, which we provide in collaboration with Disaster Pharmacy Solutions. And then we also have a basic package as well, which is just us that provide this, and Disaster Pharmacy Solutions actually provide a separate template that is priced very similarly. The tool for mitigation. So this is just a quick screenshot of some of the questions in this tool. So again, focused on the reduction of emissions. You have some questions here on inhalers and on social prescribing, and a really kind of easy access form here. And then if you're interested in the certification, it also provides you with additional SOPs specifically for when you're answering kind of key questions. It will give you some more detailed recommendations as well as SOPs. The tool for adaptation is very similar. So again, you have this basic tool that talks about everything from, these are just some of the questions, you know, if you were in a position where you had to ration medication, what would you think about? And then communication procedures, specifically with the public with regards to changes of hours of operation and changes of services, and all of the different things that you can think about with regards to you know, what would be a good idea to basically implement. So a lot of these things with adaptation, there are some recommendations in this. There's a recommendation report that comes with the tool, and it provides all of the various options. It's basically a select all that apply type thing. And, you know, the recommendation report for the tool basically gives you all of these options that you can think about too. But the certification provides, again, some more processes and some more SOPs that basically save you some more time. And then the consultation package also includes a climate-friendly review of your pharmacy business insurance as well. So the conclusion is that the pharmacy profession is on the front line of a climate crisis. The healthcare system has a really big emissions burden, and medications count for a lot of healthcare emissions. The climate crisis is also causing a really big impact on patient health, and it's causing an impact on access of medications as well with regards to drug shortages, and this is anticipated to get a little bit more unpredictable as well. With mitigation, we're thinking about trying to reduce emissions and reduce pollution more broadly related to planetary health, but climate mitigation is focused on the emissions specifically. Pollution reduction, again, is more related to planetary health. And then you also have climate adaptation that also includes your disaster planning as well, and your medication management in heat waves, and understanding the impact of the health impacts of the climate crisis and as well. So there's a lot of opportunities as well for cost savings here, and there are opportunities to be able to get involved both on a volunteer basis as well as be involved with regards to your own pharmacy as well. So thank you. That's everything.
Thanks so much, Shaliza. That was really great. Really appreciate you sharing these important considerations, especially in our changing world where, you know, you went over climate mitigation, adaptation, and also disaster planning. And, you know, for all we know, people on the call, pharmacists across Canada as well, right? We may have to, like, you may not be able to avoid doing some of those things eventually if there is a natural disaster. So it's important to do some of that planning. I think everyone has a better understanding about the timeliness of this topic, so that we can plan to better support our patients. Before we get into the questions, just a quick reminder, everyone, whoever has any questions, please feel free to put them in the chat. I just want to point out that some of the things that you mentioned, especially for mitigation, also line up with best practice guidelines anyway, right? So it's aligning to guidelines, better taking care of our patients, better taking care of our environment and our business at the end of the day. There are some questions in the chat, and maybe I'll read the first one and Fatima can read out the second one for you. So first question from Dean, as most of the actual manufacturers are overseas and not manufactured in Canada, are Canadian or USA companies influencing manufacturing practices worldwide?
Yeah. So this is a really good question. There's different things happening at different levels right now. and I'm just going to basically take the example of my work with the International Pharmaceutical Federation right now. So right now, you know, depending on the country, you have individual healthcare systems, national healthcare systems, and in, let's say, the UK, that are basically trying to incentivize manufacturers to be able to reduce emissions. So a really good example is with the NHS, in order for you know, facilities to be able to, in order for manufacturers to be competitive, they actually have to meet certain criteria to be able to get contracts with the NHS more broadly. So, and those criteria include a 10% weighting on emissions and on plastic reduction more broadly. Within Canada specifically, it's the situation is kind of mixed. On the hospital level, you have, let's say, Health Pro that has now started a sustainability scorecard. That is now trying to kind of look at a certain percentage weighting specifically for manufacturers as well. And then you have otherwise, you know, groups like McKesson who are instead trying to kind of emphasize the work that they're doing on scope 1, scope 2, scope 3 emissions on their website, and kind of more broadly with regards to, you know, just as part of their strategic plan. But we kind of are anticipating that work is happening in this area. That work happening in this area is going to kind of really, really pick up as well. Some work is already happening. It's basically a mixed bag. So yeah, we are having this mixed bag of reductions of emissions within manufacturing specifically, whether it be batch and continuous manufacturing processes that are being looked at, renewable energy that are being implemented within certain facilities as well as looking at changes in packaging. I do think we are at the beginning of like a big explosion though. So we're on our way there, but I feel like Canada is further behind than, let's say, Europe, for example.
Thank you for that. I guess part 2 to the similar question was, are there certain manufacturers who practice environmentally friendlier practices than others that might influence our choice of product? That salbutamol statistic is shocking.
Yeah, so absolutely. So with some products, I feel like it's a little bit easier to tell than others. So salbutamol is actually one of the ones where it's a lot easier to tell. So there is a Teva salbutamol product which is an MDI inhaler. It's still bad in the sense that it has an emissions footprint associated with it, but it's not as bad as, let's say, Ventolin is. So I think, you know, and the reason is because it has a lower volume propellant than Ventolin does. So there's Cascades Canada actually has like an inhaler, side by side kind of comparison, which is pretty impressive as to how much emissions is associated with specific products. In other areas, it's a little bit more murky at the moment, because in order to do you have to do a full life cycle analysis to be able to understand exactly how much emissions is associated with a particular product from start to finish. So, you know, we do know, like for the plastic products specifically for Climaceutics, we are in touch with all the major manufacturers or major vendors there, and the stance we take is we just need to basically see data, and if we can see data, then, you know, we're happy to basically include that data on our recommendation report. So far, Ecolofarm has submitted that data, and we've reviewed it, which is great. I know Ecolofarm is also a vendor for you guys, and I'm not saying that the other two aren't good at all. That's not what I'm saying, but I think this is going to be basically a work in progress. But certainly, I think the MDI inhalers are a really good starting point.
Thanks, Shaliza. That kind of goes into another question that we have as well, which you already mentioned, that Cascades resource for comparing NDI inhalers. Is there any other references that pharmacists can use to compare climate impact of various medications?
Yeah, so sorry, can you repeat the question? I just wanted to make sure I was just seeing something else at the same time. Yeah.
And no worries. Is there a reference that we can use to compare climate impact of various medications?
Yeah, so unfortunately, like your inhaler one is your major one that I would say I would definitely look at, because inhalers do have a really big carbon footprint. There's also something else specific to anesthetic gases, which I won't get into here because I know we're talking to a community pharmacy specific audience. There is more and more work that is happening specifically on life cycle analysis for other medications, but I would say it's still a little bit patchy right now. For pharmaceutical pollution more broadly, there is a database that Sweden operates that focuses on, the ecological toxicity of specific medications, which is a really interesting area. So again, that is not specifically climate related, but that's more about, do medications kind of stay in the atmosphere, like in kind of the aquatic environments, and if so, what kind of harm does it cause to kind of ecologically, for example. But I think this area is expanding really fast, so it's possible that in a year's time I will have a different answer to this question.
Great, Shalisa. There's another question as well. You mentioned how fast the area is expanding and changing. Do you foresee any requirements coming from either regulatory bodies or recommendations from associations in terms of what minimum planning needs to be in place or resources need to be in place when these events happen?
Yeah, this is an excellent question. I would say that I anticipate that the climate adaptation boat, like there's a lot of, it's going to move a lot faster, or not that the mitigation boat is not moving fast, it is, but adaptation, a lot of people have their eyes on adaptation right now. And the reason is because adaptation includes your disaster planning. So let's say a few examples of this. The British Columbia legislature, not the college, but the legislature, has actually said that now that businesses that constitute as critical infrastructure now need to have emergency planning legislated. So CAPHE, our Canadian Association of Pharmacy for the Environment, emailed them and said, they emailed this head office and said, do pharmacies count as essential businesses? Because health was one of their categories, and they emailed back saying, oh, this is a really good question. When we get to the health pillar specifically in 2025, we're going to consult you, the Canadian Association of Pharmacy for the Environment, specifically on this question. So we also know that the Nova Scotia College of Pharmacists is also in talks with CAPHE specifically, and they're interested in both mitigation and adaptation, but they're particularly, they were particularly impacted with all the extreme weather events that they've experienced as well. So they want to talk about disaster planning. So I anticipate that this area is going to continue to move forward. And I think different provinces are going to be moving. I think we just need to keep an eye on what is happening in every province, and also advocate as well for kind of systemic changes as well with regards to this area too.
That's great, Shalisa. The comment in the chat from James, this is all very interesting. Hopefully some of this will influence national therapeutic guidelines as data becomes more concrete.
Absolutely. Absolutely. I think, in some areas, such as we already know a lot about the healthcare system emissions burden, the impact of pharmacy. We know about the impact of specific medications already. I would say that, where this area was 5 years ago and where it is now is very much different. And I would say that there's a lot more focus now also on disaster planning too. But again, I would agree. I think that, from a regulatory perspective, I do see, that changes will likely start happening for sure in the next few years as well.
Excellent. All right, looking at time, we are getting close to the end of time. I just want to thank Shaliza again for your expertise and bringing this topic to the forefront where we should all be considering it as we continue to practice in our changing world. I just want to remind everyone that if you're interested in being connected with Climaceutics, please email me at molly@wholehealthrx.ca and we'll be able to connect you. And if you have any follow-up questions, please feel free to email me as well and I'll pass them on. Again, thanks everyone for coming tonight. We will have the recording available in the next few days for you to review or for anyone who wasn't able to make it tonight as well. And thanks again, everyone.
Thank you.
Thanks, Lisa.